This is my first time giving a talk to a non-dentist. Mark approached me and he said, "Hey, Doc, can you give a talk?" And I said, "Yeah, sure." And I've given a lot of case presentations, a lot of case studies and lectures to dentists, but never to non-dentists. Can you hear me fine, Mark?
Yes, yes.
Okay. All right. So, and I thought about it. Well, I don't want to give some boring case presentation about dentistry. So decided to talk about oral health and overall health and how the oral health affects the overall health. Okay. So I like to say there's two components to the oral cavity. There's the physiological and the psychological component. Yeah, the physiological component, the oral cavity is the focal point of interaction with the body. I mean, that is the entry for a lot of good things and a lot of bad things for our body. It's also something that's very pivotal in nutrition. We use the oral cavity to chew and swallow food. There's also the early stages of digestion. So in our mouth and our saliva, we have these enzymes that break down starches and fats. So as you're eating, the digestion process already starts in the mouth. And the oral cavity is also pivotal in breathing because the oral cavity connects to our airway. And I'll talk more about sleep and sleep medicine, how dentistry is being connected with sleep doctors. And there's a psychological component to the oral cavity. And that's how we connect to the outside world, right? So, I mean, I hate to say it, but we judge people based on their appearance. So if you have missing teeth or teeth that may not be aligned, how you perceive the world and your self-esteem is affected because your mindset is, hey, how is this person perceiving me because I'm missing this front tooth here? So oral cavity is very important to someone's self-esteem. And the last 2 years, I've done a lot of cosmetic dentistry, and I've done general dentistry. That's what I am, a general dentist. And the biggest impact that I have on someone's life is when I change their smile. It just is very rewarding for me. It's very rewarding for our patients too. Okay, so that's the oral cavity, generally speaking. I'll get into more details about each bullet point. What I've noticed over the 6 years I've been in private practice is the oral cavity is usually neglected. I see very healthy individuals who are on these healthy diets, exercise, they sleep well, they eat well, but I always see the oral cavity just always neglected, and I just don't know why. The oral cavity is estimated that there are 100 systemic diseases and upwards of 500 medications that have oral manifestation. And usually in the older population, what happens is the medications that somebody who is immunocompromised or has other medical conditions, and usually the older population, what happens is you get dry mouth, xerostomia. And with dry mouth, I see a lot of patients with cavities because the saliva in your mouth has antibacterial properties that helps protect teeth against cavities. It's also, like I said, it's the entry point for many bacteria. And our mouth is not sterile. So we have some good gram-positive bacteria. And if you have poor oral hygiene, and if you have a lot of plaque buildup, that gram-positive bacteria shifts to a more anaerobic gram-negative bacteria. And I'll get into a little bit more about these bacteria and the bad things that can happen. So basically, these bad bacteria produce these tissue-destructive enzymes that break down the enamel, that break down the bone, and cause a lot of bad inflammation and bleeding in your gums. And in return, as a really severe effect, it can cause abscess formation. So these are the stages of gum disease. So here, I have my mouse. So in a healthy gums, The tooth is clean. The tissue, the gums adhere to the tooth nicely and tight. There's no signs of inflammation. There's no signs of bleeding. When this plaque buildup, the body's reaction is inflammation. So the key point here in this presentation is inflammation, and that's our immune response to anything that's foreign, anything that's bad. So at this stage of gingivitis, you have these poofy gums. When you're brushing, when you're flossing, you may see some bleeding. At this stage, gingivitis with proper oral hygiene or even a dental cleaning, this is reversible. The gums will heal. Now from gingivitis, if this is not treated, if this is not clean, it moves on to periodontitis. Periodontitis is not reversible. Unlike gingivitis, this is not going to go back. This can be managed, but this cannot be reversed. So the difference between gingivitis and periodontitis is along with inflammation of gums, you also have bone loss. Okay, so this is kind of like a sinkhole. Once you go down, it'll just go deeper and deeper, because with gingivitis, you get gums that are big and poofy. So now you cannot clean properly down inside your gums. So now plaque buildups and bacteria gets in there. It makes the situation worse. When the situation gets worse, the gums get even bigger. Now there's bigger bone loss. There's more space between your teeth and your gums. Now this progresses to advanced periodontitis, where you have even more bone loss. So this is the stage where a dentist intervention is needed. And this is the stage that we recommend getting. A lot of you guys may have heard of is deep cleaning. Deep cleaning when we go inside the gums and clean all the bacteria, all the plaque that you yourself cannot reach with a conventional toothbrush and floss. So this periodontitis is going to be key in this presentation, and how periodontitis is the inflammation of gums and bone loss. And later, if it's severe, it can form dental abscess. Okay. So that's gum disease. The next is cavities. So a cavity starts out in the enamel, and teeth are very much like M&Ms. They have a very hard outer core and then a very soft inside. So once the outer core, the enamel, is penetrated for bacteria, it decalcifies, get weak. The bacteria gets inside to the mushy, to the dentin part. This is the dentin part is reaching there. Once it reaches there, then the progression of cavity is very, very rapid. So it gets bigger and bigger. What happens is eventually the cavity reaches the pulp. The pulp is these canals that homes where the nerve and the blood supply of the tooth reside, right? So this cavity goes down into the pulp, and now it's connected to your bloodstream. So now this bacteria causes all these bad things as an infection. That's where you have that severe toothache, the severe sensitivity to cold, to the severity where you're kept up at night. That's when the bacteria hasn't reached the nerve. So once it reaches the nerve, there's basically two types of treatment. At that point, we have to do a root canal on the tooth, basically take the nerve out, or we have to take the tooth out. That's where the decay gets very severe. Okay. So I'm gonna shift from the oral cavity to systemic health and the overall health. And this is where I talked about how the oral cavity affects your body. So if you have greater number of missing teeth, the poor quality of life, poor quality of health that you have, because your nutritional intake is affected, because you're unable to chew foods that you were able to if you had teeth. I mean, even eating something like apple, something hard, is very difficult without teeth. So you're basically on a soft diet. And like I talked about earlier, there's a social and a psychological impact that we have from missing teeth or crooked teeth or whatever. They're not ideal. Okay. So one condition that is bidirectional, meaning there's a cause and effect on both, is diabetes. Diabetes is a disease of body's glycemic control. Okay, there's two types. There's type A, type 1, and type 2. Type 1 is where your body's unable to produce insulin. Type 2 is where your body produces insulin but is resistant to insulin. What insulin does is insulin signals your body cell to uptake glucose and break it down and use it as energy, or break it down and store it as fat. So if insulin is not working, if you don't have insulin, then the glucose just sits in the blood, and that's what causes the blood sugar levels to rise. Okay, so the prolonged exposure to hyperglycemia, prolonged exposure to high blood glucose level causes complications such as periodontal disease, and I'll get into more a little bit science behind how that works. And it's been proven that high blood glucose levels negatively impacts oral health and causes periodontitis. And periodontitis, in return, negatively impacts the glucose level. And it's been found that individuals with diabetes have at least 3 times greater risk of developing periodontitis than those without diabetes. Okay, so patients with diabetes generally have very poor wound healing, and they have greater amount of bone loss, because once the body's reaction, they talked about gingivitis and your immune system and how your body responds to plaque inflammation. People with diabetes who have poor wound healing are unable to fight the bacteria. The immune system is compromised. Okay. So here's how it kind of works. So the prolonged exposure to high blood glucose level results in advanced glycation products. So your body produces these products if the blood glucose level is too high. And these products cause inflammation. Now, when we talk about gingivitis and periodontitis, it's inflammation. So if you have uncontrolled diabetes, it causes inflammation. Now, in return, if you have periodontitis, so if you have this inflammation, now inflammation in the mouth affects how your body controls the glucose level. So it's one of these things where if you have one bad thing, the other one happens. And if the other one happens, then it is by direction, one causes the other. So it's kind of a cascade effect. If you have uncontrolled diabetes and uncontrolled periodontitis, your condition will just progressively get worse and worse and worse. You know, a lot of things that's a lot of things I looked at in my prior practice. Is I just see such an increased level of gum disease in patients with diabetes, especially patients with uncontrolled diabetes. Okay. Oral health also affects heart disease in your heart. Atherosclerosis is the narrowing of your arteries. Narrowing of your arteries due to deposition of cholesterol and cholesterol products in your vessels. And atherosclerosis is usually the primary cause of coronary heart disease, which leads to heart attack, and cerebral vascular disease, which leads to stroke. So coronary heart disease or heart attack is when your body is unable to give your heart the oxygenated blood, so you get a heart attack. A stroke is when your body is unable to give your brain oxygenated blood. Okay, so if you have a blockage in your arteries, so the blood cannot flow, and that's what ends up happening. Like we talked about before, periodontal disease and oral hygiene results in the inflammation and also results in bacteremia. Bacteremia is bacteria in your blood. So when you have a lot of bad stuff, a lot of bacteria in your mouth, it eventually goes into your bloodstream as well. And once that bacteria goes into your blood, your body's reaction, like I said, is inflammation. So key in all of this is inflammation, and that's your body's immune system's response to foreign objects, bad bacteria. Okay. So the connection between heart disease and the oral cavity is a chronic inflammatory state. So you're always in that stage of inflammation, and it triggers pro-inflammatory products in the body to stimulate the process of atherogenesis. So if you have periodontitis, you have this inflammation in your body's reaction is to start producing fatty plaques, okay, fatty plaques in your arteries. Now, when you have this periodontitis, you also have this bacteria in the mouth, okay? So bacteria goes into your bloodstream, and now that bacteria in the bloodstream causes platelet aggregation. Platelets is, so in blood, there's three components. There's red blood cells, white blood cells, and platelets. Platelets is what causes blood to clot. So this bad bacteria in your bloodstream causes platelet to aggregate. So when the platelets aggregate, it ends up with a blood clot. And you all know blood clots is very bad. It can block arteries and can cause all sorts of bad things. Okay. Now, lastly, the systemic health is pregnancy. Something called pregnancy gingivitis that I see very commonly. In a female's body, when she's pregnant, there's a lot of hormonal changes due to pregnancy, a lot of changes in estrogen and progesterone. So a lot of these changes in the hormones causes capillary dilation, which results in gingival enlargement. So you have a lot of blood going through into your gums, and your gums get really poofy. And when you brush and floss, it looks like gingivitis. So if your gums are poofy and big, like I said, it makes it hard for you to go and clean underneath that gums and underneath the all the buildup of just floss and brushing. That's when the dental and the hygiene is key when you're pregnant, to have good oral health before pregnancy, and during pregnancy is key to come in and have your teeth clean. Usually I would say more than twice a year. I will talk about where that twice a year came from as well. So anyway, so if you have this big poofy gums, what happens is the bacteria gets in, and then a lot of the bad bacteria gets in, and that starts the cascade effect like I talked about. You have good bacteria and bad bacteria. So with poofy gums, all the bad bacteria starts to accumulate and causes bad things as periodontitis, cavities, enamel weakening. So a lot of things to think about for females who are thinking about pregnant or who are pregnant. What I want to say was the cleaning that's generally accepted in America is twice a year. That twice a year cleaning was not something that dentists recommended. That is insurance based. So dental insurance decided that we Americans who have insurance should get cleaned twice a year, which will mean that everyone in this country has the same hygiene as the next person. They have the same health as the next person. So my hygiene will be very different from yours, and yours will be very different from everyone else. So not everyone falls into this twice a year cleaning. Some people require more than twice a year. And that is something that your dentist and your hygienist will recommend. Sometimes I have patients come in every 3 months because I need to see them every 3 months, because 6 months will prolong their treatment. And within that 6-month period, a lot of bad things can happen that's not under my control. Now, the bad thing that happens there, the insurance does not pay. And if you're very insurance driven and you let insurance dictate your life, you let insurance dictate your treatment, then that can be problematic. And that's a lot of what we see as well. Another thing I want to talk about is sleep and sleep medicine. This is something new in dentistry. when I'm doing my exam, I'm looking at your teeth and I'm looking at the wear patterns on your teeth. There's very distinct patterns of wear that I see on patients who grind their teeth. Okay, the grinding their teeth is because their bottom jaw is just moving around at night, looking for space to breathe. Now, sometimes it is not because the mandible or lower jaw is moving to looking for breathe. It's just out of habit. Maybe there's stresses in your life, and at night you grind your teeth. And I've seen that more than 90%, this is just based on my private practice experience, 90% of patients who grind their teeth usually do it at night when they're not aware of it. But I can tell by the wear patterns on the teeth that do grind it at night. So how do I differentiate to see if you're grinding at night because you cannot breathe at night or you have difficulty breathing versus if you're just doing it because it's just out of habit or you're stressed? So I look at the medical history and I gave you this questionnaire about sleep. Do you have high blood pressure? Do you often feel weak during the day? When you're sitting around watching TV, do you usually fall asleep? Or when you're driving, do you feel like you're falling asleep? Or when you're reading a book, like after a page or two, you fall asleep? That sorts of things indicate that you are sleep deprived. That means that at night, you keep waking up because you're not getting enough oxygen. So your mandible moves around looking for oxygen. So I can tell you that, hey, you have some sort of sleep disorder. As a dentist, I cannot diagnose anything, but I can tell, hey, something's going on. So I work with a sleep physician who will give you a take-home sleep test or in the office, and they monitor your sleep. So once they monitor your sleep, they can either prescribe CPAP machine, or if you're don't like the CPAP, or if your sleep is not that bad, sleep disease, we can do is make an oral appliance. The oral appliance does is it moves your mandible to a position which opens up your airway. So see how oral cavity is affecting your airway as well. Sometimes when you're laying back, your mandible goes all the way in the back and it blocks your airway. So we give you this appliance that you put in at night and that helps you breathe better. And a lot of patients say that that's like the life changing because they feel so refreshed. They have great health and they're able to go into the deep state of sleep because their body is now waking them up looking for oxygen. So that's something very interesting with sleep that's been going on between dentists and sleep doctors. It looks like I'm going overboard here, Mark, 9:26. So we'll get at that.